How I went from a hot hormonal mess to a holistic medical doctor, and how you can do the same in just 10 weeks. Hi, I'm Dr. Patricia Mills, Holistic MD, and welcome to the Wild Wisdom Show. I'm a medical doctor with a different spin on health, and today we're going to talk about my transformation story, wild wisdom that will powerfully change your health in just 10 weeks. Now, if you've been following me for a little while, or perhaps you're finding me for the first time, I wanted to share with you my journey and how if you listen to it and reflect on your own journey and where you're at right now with your health, finding some parallels and similarities within the differences, because every person is unique in terms of how their health is impacted by gut problems, hormone balance issues, the stress response, toxins tolerance. But all of us have very similar root causes. It's just how they express themselves over time depends on our gender, our life stage, a combination of those factors, what I call my four pillars of whole body health. So that's the gut, hormone, stress, and toxins. And our genetics. How do these factors interplay with our genetics? And as I tell my story and then provide you with the solutions that I came across so that you can have your own powerful transformation story, just reflect back on your life and identify where things may have been starting to show up for you and how they're showing up for you now, so that you can start to reflect on what changes you can make in your life to change your story. And if you're joining me live through my private Facebook group, please put in your name, say hi, where you're from, and let me know if you have any questions that pop up, or if you have any aha moments in your life as well. So I'm a medical doctor, and I'm a specialist in physical medicine rehabilitation, practicing functional medicine. And I'm also a researcher. So I've published over 25 papers, research papers. I've previously been invited to international conferences to present my publications and my research. And despite all of that, before I became a functional medicine doctor and I was practicing as a specialist, medical specialist in Vancouver, British Columbia, Canada, I was very much unaware, and maybe this is a similarity that you may have in your story, of the fact that my body was giving me multiple signals that all was not well with my foundational whole body health. So I'm going to talk through some of the signs that my body was sending me, and perhaps reflect through on some of the signs that your body may be sending you that you are either aware of, or maybe through this conversation you'll become aware of them. So, for example, I had been having issues with constipation since a young age, right? And no one told me that that wasn't normal. It's common, but it's not normal. What's normal is to have a good bowel movement at least once a day, but that was not the case for me. But no one knew better. My family didn't know better, so I just kept on having this gut issue. And eventually I was diagnosed with irritable bowel syndrome because it started to fluctuate with my menstruation. So it'd be very constipated before becoming menstruated, and then a little bit of diarrhea after. So I went to my family doctor and got this diagnosis and was prescribed some Senna, to get the bowels moving. That is a Band-Aid solution, not a root cause solution, right? There are many root causes for my constipation, but I didn't know it at the time. And obviously my family doctor didn't know either, or else she would have done differently. And then over the years, I started getting some signals that I wasn't aware of, and kind of either ignored or didn't realize it was a signal that things were not well with my hormone balance. I started getting adult acne. My periods were getting super heavy and really painful. I started to dread my menstruation. And I remember a very poignant time in my story, in my life, was I had done my 4 years of medical school, and then I did my 5 years of specialty training in physical medicine rehabilitation. And it was the night before our final exam. And so all of the residents who are going to prepare to become a specialist, and they do this big exam, And there's multiple stages to the exam. You have to write, this like 2 days of written exam. And then there's this one day where all of the medical residents from all across the country fly into Ottawa, the capital of Canada. And there's what's called an observed standardized clinical encounter examination, where there's a full, I think it's a half day, where you go through different stations. There's patients, people pretending to be patients. So actors that are hired and trained to pretend to be patients in each station. And there's a doctor there that you either have heard of or know and respect. And they are sitting in the corner with their grading material, just basically writing away and observing you as you're expected to do a history, a physical exam, and deduce like what is the diagnosis. It is basically the most incredibly stressful experience that a person can encounter in medicine. And we prepare for it for over 5 years, but it is still just extremely stress inducing. And the night before this exam, I'm in the hotel room and my period comes on. And I'm up all night cramping away. I'm chewing ibuprofen anti-inflammatories like candy just to get on top of the pain, not knowing that this practice that I've been having for a few years now, as my menstruation got worse and worse, is also destroying my gut health. And and I'm hemorrhaging basically, like I'm just using so many menstrual pads. And I'm thinking to myself, oh my goodness, how am I going to do this exam tomorrow? Like, first of all, how am I going to do it while I'm in this much pain? I'm bleeding, like I'm going to bleed through my tampon and my pad. It's going to be so embarrassing. Thankfully, I was running on adrenaline the day of the exam, so I was able to complete it. And that night when I went to a party, a celebration party with family and friends, I actually had to change my pants twice because I bled through my tampon and my pad, but thank goodness it didn't happen during my exam. And I just was completely oblivious. I thought this was normal. When I had gone to my family doctor again about this in the past, there was talk about an oral contraceptive pill or the IUD Mirena to help control these symptoms. Again, a band-aid solution, which is incredibly helpful for the symptoms, but doesn't get at the root causes, which was I had significant hormone imbalances. And the root causes of that were, again, related to my gut health, related to my toxins, my stress response, and things that I was unknowingly doing to imbalance my hormones. But I didn't know this at the time. So, I eventually did get the IUD Mirena, which helped my periods go away. And the underlying causes of my hormone balance continued. So that over the years, I started to notice other problems. I was getting fibroids. I experienced infertility when I did want to get pregnant. I started getting facial rashes, and you name it, I had it. It was starting to get very bad, but I still did not understand that there were things that were going on that I could do something about to get to the root causes and not have to use medications as a band-aid solution. It took a drastic turn of events in my life for me to get to the point where I started to learn the science of root cause medicine, also known as functional medicine, which I eventually certified in. And the turning point for me was not my own health issues, but the health issues of my dad. So here I was now at this point in time in the story, I was a practicing physician, a specialist consultant at one of the biggest rehabilitation hospital in BC, known as GF Strong Rehabilitation Center. And I was a specialist who was on the spinal cord injury ward, taking care of very complicated spinal cord injury patients. I was doing the, spasticity management, outpatient neuromusculoskeletal clinic, where I saw all kinds of conditions ranging from multiple sclerosis to rheumatoid arthritis, Parkinson's, multi-trauma, amputations, significant diabetic complications. My specialty and what I was doing was seeing the most complicated of people, all the consequences, and helping them with rehabilitation strategies, including, prosthetics and orthosis and social work assistance and occupational therapy and medication and those sorts of things. So I loved what I did. However, what happened was I got a call, or actually, I got a text. I was on the ward, the spinal cord injury ward, doing my time as a specialist there. And all of a sudden, my phone beeps, and I'm writing notes in the patient charts in the back room there with all the nurses around. And I get this call and this text, and I look down, and my dad is texting me saying, I saw the neurologist. He thinks I have ALS, amyotrophic lateral sclerosis, or Lou Gehrig's disease. Now, if you're not aware of what this condition is, it's a fatal disease with no cure. If you do have it, you're pretty much going to die from it within about 5 years, give or take a few years from the diagnosis. And it involves progressive loss of muscle function. So the muscles simply start to deteriorate, and it can start in different places in the body, but over time it progresses to affect almost every body part. So it can start around the mouth, and the swallowing and the breathing muscles. Those people die very soon. Can start in the arms, in the legs, in the torso. For my dad, it had started in his dominant right hand. And months previously, he had told me some interesting things that were going on. And I said, Dad, why don't you go to your family doctor and I recommended a few tests. And in the back of my mind, I was thinking ALS because I had worked at an ALS clinic as a resident in training. And so I was familiar with the early signs, but I was thinking, oh goodness, that wouldn't happen to my dad. He's so healthy. He's a Ironman marathon runner. He's, following everything that he's supposed to do with his health, as far as I know, like recommendations of how to eat. Anyone would say that he's a generally healthy guy, and we had no family history of this whatsoever. And what I want you to know is that this is becoming a more and more common thing where people without any family history are starting to be diagnosed with these weird, unfortunately more frequently diagnosed conditions like ALS, multiple sclerosis, Parkinson's, Alzheimer's, all of these things. And people who have a family history of diabetes, high cholesterol, that kind of stuff, they're getting more and more, we're getting more and more of those people being diagnosed with that too. It seems to be more and more prevalent in families than it used to be before. And in children, ADHD, autism, all these sorts of things, right? But I was never questioning why until my dad got diagnosed. And because I was intimate with his story, I really was perplexed. I mean, first I grieved because I knew what that meant. And so I had my grieving process right away, just collapsed on the floor, crying, had to leave, couldn't work for a few days. I think I couldn't work for a week at least because I just was in this deep grieving process. And once I recovered from that somewhat enough to function again, in society, it occurred to me to ask, I was like, why? Why did this man develop this condition, right? It's not genetics. It's not genetics. It's something else. And I started to ask the question why in other areas of my life. I'd be seeing patients coming to me with these diagnoses, no family history, and I'd be wondering why. So I started to ask more about their lifestyle. I started to pay more attention to my dad and his lifestyle. And I even started to ask questions about my why. Why am I having these? At the time I thought I was doing everything right. I thought I was eating right and exercising right, living a healthy lifestyle. And despite that, I had to come to terms with the fact that I was just not healthy. I was not experiencing my best health. I didn't have a medical diagnosis, but I was not experiencing my best health. And once I started to ask the question why, I started to search the research because I remember I'm a researcher at the time. I was already a published researcher, already had over 20 publications under my belt. And one of my bread and butters was to do systematic reviews of research, which means that you have to review like sometimes anywhere from 500 to 5,000 studies and make sense of the results and summarize that into a paper so that other people can understand what's available to know about that condition. So I started to go into the research, and that's when I came across research on things like the gut microbiome, right? Like the buddies in our belly, which I'll be talking about in future episodes, and how how their health is linked to our health, and how modern society and our modern day foods and culture and lifestyle and all these things are just harming them, which ends up harming us. I started to learn about body inflammation and things that we're doing again to cause inflammation within our bodies. I started to learn about blood sugar regulation and how that impacts our hormones, even if we don't have prediabetes or diabetes. I started to learn about exposure to toxins and how women in particular are having a real hard time with that one and how that messes up our hormone balance. In short, my eyes were opened and I started to go beyond what I was taught in medical school and my specialty training. And we're talking, 9 years of training here. I had to go beyond that, what's not taught in that setting, but is in the research. And in the end, I found the field of functional medicine, which is root cause medicine. Got really excited because it was, started by doctors just like me who either themselves or their loved ones were getting sick and they just weren't happy or satisfied with the current medical paradigm in terms of more so of a band-aid solution approach rather than the root cause approach. And then I certified in functional medicine. It took me about 2.5 years of additional training and just received my cert. Now it's, we're in September 2023. I received my certification in June 2023. And it really equipped me with the knowledge and the strategies to actually address all the root causes. So it was unfortunately too late for my dad by the time I acquired enough knowledge to know how to help him improve his situation. However, it was not too late for me. I did reverse all of my health issues. I restored my gut health, rebalanced my hormones, addressed my toxins. I'm still working on my stress response. It's a daily effort, working on sleep quality and all of those things. And, a few years into this, I started to become unsatisfied with my inability to provide this information to patients in the regular medical setting that I was in. The visits were just too short. And the time between visits were too long. It's just the way that the medical system here, at least in Canada, is set up. And that, I realized that I needed to start providing this information and these strategies to people. And I focused on women's health for my health promotion, for health promotion programs. So I started to provide health promotion programs, and I provide two now, where we go deep into all of the information and strategies that I wish I had had at the time, and that took me years to acquire and put together. But it's all been synthesized now. And I've been developing these programs or providing these programs now for years. So there's also a lot of learned experience on how to best deliver a health promotion program, how to keep people engaged, how to get results, right? And how to create community. And I wanted to let you know about one of these programs because if you're watching this in September 2023, you have an opportunity to join the October 2023 cohort. If you're watching this or listening to this at any other time of the year, you can still use the link in the show notes. I'm going to tell you about this program in more detail to put yourself on the wait list so you get a chance to be one of the first people to sign up because my groups are small and intimate. And the one that's coming up in October, and I run this every October, is called the Wild Collective. It's where we achieve your highest health, wildest health, with a personalized action plan and expert guidance. And that expert is me. So, what we do is that in 10 weeks, we cover 10 foundational health topics. It's a minimum time commitment of 1 hour a week, but an opportunity to do more depending on your level of interest and commitment to your health at the time. But at the minimum, you want to dedicate an hour a week to this, right? And your health is worth that minimum time commitment. That I know for sure. And some of the topics that we cover include gut health and how to restore it, information on hormones and how to balance them naturally at every stage of life, whether it's premenopause, fertility, menopause, right? We talk about blood sugar balance and optimal eating strategies, which, by the way, chances are, unless you've been following me and you're starting to get a real understanding of what it is that I'm offering and teaching, what you're eating is probably not supporting your health. Unfortunately, we went in the wrong direction with a lot of recommendations for healthy eating. My dad was one of the casualties, so was I, and it's nobody's fault. It's just sometimes certain research results are very biased or are misinterpreted or are influenced by industry. And so we need to put all of that aside and focus on what really works. Okay. We talk about thyroid health and how to support that for optimal metabolism and energy. We go deep into sleep, how to resolve inflammation. And that's the basics, that's the foundational stuff. Okay. And then, depending on the interest of the participants, we'll do some deeper dives. And that could be, for example, the pros and cons of bioidentical hormone replacement therapy for different conditions, weight loss specific to life stages like postmenopausal weight loss, midsection weight loss, right? Weight gain around the midsection, menopausal hot flashes, PCOS, endometriosis, fertility, lots of education that can be done in that area. And the way that it's set up is that during the 10 weeks, we have video lessons that are released every week. So you watch the video lesson. At the end of that video lesson, you're going to have some questions that come up. I hope so, because a curious mind is important when it comes to learning about health. And then you have two options for how to ask your questions. And this is a live program with me. I'm following along it's not a self-paced program. We're doing this together. We're holding hands over 10 weeks, doing this together in the group, okay? And then you get to ask your questions either through the online private group chat or through the live Q&A and deep dive sessions I do once a week. I host them once a week, and you can either attend live or you can submit your questions. And if it's a question that can't be answered short form over the group chat online, I'll answer them long form in the 1 hour live session. And with this format, we get to cover a lot of information, and all the replays of the lives are uploaded to the platform where you have the video lessons available. You have the live replays available, and you have the group chat, and that's all on my private platform called Practice Better, which is very powerful, very easy to use. You can access it on your computer or through your phone. And, common questions that people ask me is like, what about the time commitment? What about the work conflict? I'm working. What about the investment, right? Financially and, my online access. And what I have to say is that it is a minimum 1 hour time commitment. To get the most value out of your experience, you would commit 2 hours. That's one hour to watch the video lesson, 1 hour to watch or participate in the live session or watch the replay. In terms of work conflict, it's okay if you can't attend the lives during the day. The lives are on Tuesdays at noon Pacific Standard Time or 3 p.m. Eastern Standard Time. And if you can't attend that live, no worry. Again, you submit your questions beforehand and you get the replay in that private platform online portal, the Practice Better, so you can watch it at your own time. However, you want to watch the video lesson and the replay within the 1 week time frame for that, so that you are not falling behind. You're staying up to date. You get to keep asking your questions, and it really provides a good accountability and keeps you on track, because as we know, sometimes when we're left to our own devices, we tend to deprioritize ourselves. So when you're in the community and you're working with me live and directly, it really motivates you to stay on top of things. The financial investment, it's interesting. Having seen the suffering that occurs when we don't invest in ourselves, there's no price to be paid. There's no price you could put on having the peace and the calm and the joy and the happiness of experiencing your best health. So that is a personal thing that each person has to navigate. However, these opportunities to work with people like me are rare, especially live programs like this. So really, I personally think it's really worth the investment. And I wish I had had something like this when I was starting to realize that my health really needed support. And again, you can access this through a computer or through your phone, and there's secure online access to a very powerful online platform that I use. So if you're interested in this, check out the link for the information page and registration page in the show notes. Again, if you've missed this opportunity for the October session, whether it's October 2023, 2024, 2025, right? For as long as I continue to offer this program, and I don't know how long I'll continue to offer this for. So telling yourself like, I'll wait till next year or now's not the time, you could miss out forever. Right? These things are not set in stone. I am offering it this year, 2023, October. Okay, it starts October 3rd. The last date to register is October 2nd. You do not want to miss out if you're catching this in time. If you're not, go to the information page and put yourself on the wait list. Okay, so that increases the chance of you being able to register in the future. So if you have any questions, I see there's some people watching. Thank you for joining me today. It's been so lovely being in this space with you. And if you're looking forward to the next Wild Wisdom show, we're going to be focusing on the gut microbiome, right? Remember, I said that that was one of my root causes of disease. There were many different root causes. Again, that's why it takes 10 weeks to really go in depth together to like look at all of the root causes, right? And by the way, when you do a live program like the Wild Collective with me, you'd be surprised at how it's delivered in a way that you simply could not access the information in that way through these platforms. You know, the YouTube lives and the podcasts and things on Instagram and that kind of thing. They're helpful, and you should definitely keep continuing with them because they will move you forward. But when you participate in something like the Wild Collective, your gains are accelerated from a matter of years to within a matter of weeks. So if you want to accelerate your health gains and reach your health goals way faster, you're going to want to check out the Wild Collective. Okay. So thank you so much for joining me. I appreciate you. I appreciate you taking the time, and I look forward to seeing you, or I look forward to being with you in our next show. And please feel free to save, share, and subscribe if you're coming across this. I appreciate you. And that is the best way to show your appreciation as well. Thank you, and hope you have a wonderful rest of your day, evening, or night, depending on when you catch this. Bye.